In our last video tutorial, we looked at suicide data by primary care area. Today, we're going to use the Community Profiles dashboard to locate primary care areas, or as we call them, PCAs, with high death rates for influenza or pneumonia. The first thing we must do is change our geography from counties to PCAs. Next, we must change our variable from cancer to influenza and pneumonia. When we do this, we're going to want to select our most recent data. When we look at this data, we see a wide range of values. Some communities are much higher, while others are a lot lower. We want to identify those communities with the highest rates, then gather as much information as we can about these areas to aid our public health professionals in developing an effective intervention strategy. Let's first select the PCAs that had the highest rates last year. To do this, I'm going to switch our map to a table. Let's maximize that table, then sort an influenza and pneumonia variable. We'll sort descending and select the top 10 highest rates. I only want to target communities with consistently high rates, so I'm going to look at PCAs whose rate has been higher than the state rate the past 4 years. To do this, I'm going to switch my bar chart to a trend chart, and let's maximize that. I can come in here and identify the Arizona state rate, and now look at all these communities who have had a rate lower than the state rate in the past 4 years. I want to take these communities out of my analysis. So I'm going to identify them: Golden Valley, Somerton, Snowflake, Globe, and Drexel Heights. Now I'll go back to my table and deselect those communities. We have identified communities where influenza and pneumonia are an issue. Now we're going to use the dashboard to locate facilities in the area that could help us combat the problem. To do that, I'm going to minimize our map and take a look at our legend. We can add layers to the map to get a better idea of the health facilities in our communities. I'm going to turn on the FQHC layer. FQHC stands for Federally Qualified Health Center. These are places where people can get health care on a sliding fee schedule. Since we know poverty is high in these PCAs, FQHCs are particularly important facilities to identify. I can scroll over every FQHC and find the name of it. I can also zoom in to get a better idea of where it's located.